Hi, my name is Garrett Wong. I'm the medical director of the Chronic Total Occlusion Program and the director of the medical cardiac ICU at UC Davis Hospital in Sacramento, California. I'm here today to talk to you about the Asahi Corsair Pro XS microcatheter. Just as a background, the Asahi coronary microcatheters initially came out in 2009 with the Corsair, and it was initially developed as a channel dilator to get through some of the more complex lesions that we get into with our everyday chronic blockages and lesions and whatnot. And it's become the standard of care usually for our chronic total occlusions, as well as our very difficult lesions. It's progressed along to get to the 2016, the Asahi Caravelle catheter. And this is a smaller, low-profile catheter to get through some of the even more complex and tortuous lesions. And the Corsair Pro with some new enhancements and design features in 2017. And what we're talking about today, the Corsair Pro XS, which came out in 2019. So talking about some of the microcatheters, you can see here the Corsair Pro. And one of the advantages of the Corsair and the microcatheter technology is that it enhances increased crossability. It also gives more support for your guide wires to get through some of these chronic lesions and typical lesions that we may get through. But of course, the braiding allows us to get better torqueability with the catheters as well, useful for both antegrade approaches, retrograde approaches. But if you look below at the Caravelle came along with even a lower profile microcatheter system. And the advantage is here that it could even better trackability and as well as better guide wire maneuverability as well for some of these very complex PCI lesions. So that has evolved to combine some of the benefits of both of these, the torqueability of the microcatheter Corsair system and the low profile trackability of the Caravelle system. And that's led to the evolution of the Corsair Pro XS microcatheter, which we're talking about today. It gives the advantage of being a low profile tip catheter, very trackable, and it also has the torque capabilities as well of the typical Corsair system. So some of the key features and benefits and where we can find this useful. Here's just a nice comparison looking at the different catheters on the market right now. This is not all inclusive, of course, but it does show the Corsair Pro. You can see on the top there, the tip entry profile. The tip is much the same. It's the smallest tip entry profile of the torqueable microcatheters. You can see at 1.3 French. The Caravelle was a little bit larger tip entry, but the distal shaft and the proximal shaft were the smallest on the market, and it's still quite small and deliverable. The Turnpike LP, as comparison from one of the competitors, has a slightly larger tip entry profile, but again, it's a very small distal and proximal shaft as well, and gives good pushability as well. So what's the advantage of this current system here? This is actually the smallest tip profile of any of the torqueable microcatheters, and that's the key here. There's smaller catheters, but for torqueability, this is definitely the smallest tip profile you can see here. It's 17% smaller than any of the other microcatheters on the market right now, and therefore gives you a smaller crossing profile as well. You can see 2.1 French versus 2.2, which may make the difference in some of these fairly highly stenotic lesions. The distal tip, they made some changes to this as well compared to the initial Corsair design. The tip itself has been shortened. You can see the transition from a 1.3 French tip, and it goes to 6.5 millimeters. So it's a nice gradual taper and a shorter welding. And sometimes that welding portion is what adds some thickness and issues with crossability. So it has a nice smooth transition from the very low profile 1.3 French tip getting to the body of the catheter, which is 2.1, and gradually gets larger from there. Look at the bench top here with flexibility testing here. You hold the microcatheter, you can see the little animation on the side there, where in the benchtop testing, the microcatheter is held and you bend the tip of the catheter at different distances from the tip here. You can see at the bottom, the further away you go from the tip of the catheter, it increases the rigidity of the catheter, of course. So it has a very soft tip you can see there. And the purple line, the Corsair Pro XS, compared to the competitor, it has a nice gradual tip flexibility from the very tip being very soft to gradually getting stiffer as you get further back on the shaft of the catheter, which may lend itself to some easier trackability and more tortuous lesions. If you look at some of the acute bending testing, this is a model here looking at some tortuosity here. This is a kind of a hollow tube system here with a Fielder XTR wire through there. And you can see here when you advance these microcatheters here, there's a little animation going here. And this is advanced. You get to the lesion, you turn no more than 10 times in each direction, which is typically how we recommend using these microcatheters. You don't get too much of the wire binding or kinking of these catheters. You can see here it actually maneuvers very easily. You can see it tracking through this little tube system over even a pretty soft wire like the Fielder XTR here. You can see on the right-hand side, the competitor makes it through partially, but doesn't make it all the way around that acute S lesion there, or almost like a Z lesion, in fact. So what are the big changes to the shaft system? It's not just the tip that has been changed, but the whole entire shaft composite has changed as well. We know the Corsair Pro you see on the left-hand side there. What's interesting, it's made of two different wires, two thicker wires you can see there in the cross-sectional picture, and 8 smaller wires that are kind of bound together and braided in a rope coil, so to speak. On the right-hand side, though, they changed the technology now, and it's actually 14 wires that are all the same and spirally wound, and I'll show you on the next picture how that translates into hopefully more trackability and torque transmission. So 14 of the same size wires. So it's a thinner shaft is what you can see here. And Asahi has the benefit of being able to do their wire drawing technology. They've been making steel wires for many, many years and got into the coronary business with the guide wire technologies. And we all know many of the new wires that are coming out from Asahi. This is along those same lines as well. You can see on the cross section from the bottom right and going across to the left here, it's the same wire that's gradually tapered as you go from the proximate end gradually down to the tip. They've been able to manufacture these wires with a gradual taper from the proximal end all the way to the tip. So it's a nice smooth transition, and it's 14 of the same wires wrapped together in a spiral bound. You can see there with a nice hydrophilic coating on there and a very soft, flexible tip. And you can see it's a gradual taper from 2.9 at the back end to 2.6 to 2.1 and to the very tip of this, which is 2.1 French as well. And again, a nice gradual taper of these wires that make up this Shinka shaft. Looking at shaft stiffness. Again, on the benchtop testing animation, you can see on the right, the microcatheter is held and they gradually bend the catheter and to look at the stiffness. Again, it's a very rigid catheter from the flexibility, but it still allows flexibility and torque transmission. You can see it's a nice gradual linear stiffness as you go from the tip gradually up to the further back from the tip up to 90, 120 centimeters. It's a nice gradual increase in shaft stiffness compared to the competitor, which takes a little bit longer to get some of that stiffness. So it may give a little more pushability, even though it's a lower profile catheter system. Again, because of those 14 wires all wound together and a continuous ground to from proximal to distal, it may add to some ability for increased pushability through some of these highly stenotic lesions. Rotational durability, again, with these single 14 wires that all wrap together in a spiral all the way down to the tip of there, it gives a little bit more torque transmission. And some benchtop testing, of course, this is not necessarily comparable in the real world, but in the benchtop testing, which is actually very useful just to compare one to another in the same exact kind of model, it gives roughly 40% more torque transmission and durability at 10 rotations. So again, with the microcatheters, you turn the microcatheter no more than 10 times in each direction, so you don't tend to bind up onto your wires. Here's a nice little model here. You can see a very, very tight lesion going back and forth, back and forth, back and forth, and a total of 10 bends altogether in this catheter system here. And again, on this model here, you turn the microcatheter no more than 10 times in each direction. If it's moving, you keep turning, but if it hits a stop there, you turn it the other way, no more than 10 times. You can see the differences in two different systems here. The Corsair Pro XS at the top there with the flexibility, pushability, torqueability. It's able to navigate through these multitude of bends and continuosity till you get out to the very end there. I'll let this kind of play so you can appreciate the trackability through this markedly tortuous lesion. This would be a very complex lesion to pass your equipment through. Pretty impressive. Okay, one additional change that has been made as well, they increased the hydrophilic coating on these as well. The initial Corsair Pro had a shorter hydrophilic coating of about 60 centimeters from the tip to the shaft. You can see the shorter catheter, Corsair Pro XS, the 135 system, has a 70 centimeter lubricious coating, and the XS has an additional 15 centimeters, so it's 85 centimeters. So quite a bit longer than the competitor is. They actually increased this over the initial Corsair Pro as well. This is, of course, the hub that they had on the initial Corsair Pro. These spirals here add some kink resistance. You can flex this. The very initial Corsair had some issues when you turn too much. You can get some kinking and injury to the proximal shaft here. So this new kink resistant hub has been very useful. So it really tends to transmit the torque a lot easier to the tip of the microcatheter. So some suggested clinical applications, of course, microchannels and collateral tracking for these retrograde procedures is certainly its wheelhouse and a very useful application of this. Also, it is very useful for crossing your CTOs as well. So not necessarily just for retrograde procedures, some antegrade procedures, it's a very flexible, low profile tip, and it does allow some pushability and increased durability, trying to push through some of these highly stenotic, maybe calcified lesions. So what are some of the challenges in the retrograde approach? This is from the Japanese Multi-Center Retrograde Summit. Now, again, this is a little bit older data, but this is from their registry looking at patients from 2009 to 2011. And they looked at 1,166 retrograde procedures that they analyzed over from 2009 to 2011. And they found that they'd had a 72% success rate in their retrograde procedures. But for the 28%, which amounted to 328 unsuccessful retrograde cases, the most common failure modes were inability to cross the collateral channel by either the guide wire or the microcatheter. So roughly 72% of those patients, you couldn't even cross with the wire. And again, we have much newer wire technologies that are getting better and better every year to allow us to get through some of these pretty unique and tortuous retrograde or collateral channels. And now with these improvements in the microcatheter, especially the XS system, now we can get through better collaterals as well that could not be crossed with the previous renditions and microcatheters. The other part, 22% of these people, once you got through the retrograde, couldn't cross the lesion itself. So we know there's different types of anatomical features that contribute to failure modes for retrograde approaches, certainly acute bends, very tiny channels that were the larger microcatheters of past generations couldn't get through, some side branches, and potentially severe calcification. And those are certainly tricky issues for any procedure. For example, in this case, you can see here in the septal artery, if there's an acute side branch there, sometimes with the previous generations, you wouldn't have good wire control, these kind of lesions here. Now with these microcatheters, very flexible tips, you get good wire control. You can potentially steer around some of these acute bends, as well as that continuous tortuosity that I showed you in that wire model. You can really navigate this catheter through some very tight and tortuous segments once you get a wire through. So again, the product specifications, you can see here quite a few improvements compared to the initial Corsair Pro. Has a lower profile tip and a shorter tip, and a smaller welding point from the tip to the shaft of the catheter. And again, it's a graduated taper from the larger wires, proximal 14 wires, making up the new Shinka shaft all the way down to the tinsel tip, translating to better torqueability and pushability. And they added a longer hydrophilic coating as well as the proximal hub, which is more kink resistant. And you can again see the different dimensions of these catheter at the very bottom. The tip is the lowest profile of any torqueable microcatheters on the market right now at 1.3 French. So I'm going to end it with a few kind of typical case examples where it'd be useful to use the Corsair Pro XS model. And hope these are helpful for you. Typical case here, nothing too complicated here. This is just your routine antegrade wire escalation case. It does have some tortuosity to it. I picked this example because it has some tortuosity and just wanted to show you how easily these microcatheters can deliver to some of these chronic distal lesions there. It does recanalize right to a bifurcation there. So cross very easily, didn't even need much of a supportive guide, have your guide extension catheter system, got the microcatheter down pretty easily, but because it makes an acute S-turn down there using the initial wire we were trying to use, which was a Mongol wire, didn't get that much tip control, and it tended to keep pointing superiorly, you can see on the left image there. Once you got the softer tip of the microcatheter around there, give us very precise tip control. As such, we were able to use a very directional wire. This was a Gyanex second wire, which you can see here, at very fine 1 millimeter tip control, easily able to pop back in, verified we're in the true lumen, cross through the CTO segment quite easily in an antegrade approach here. Switched out for our support wires, did some IVUS, verified our true lumen there. It's interesting that it appeared that the previous wires did create some dissection planes in there, a small amount of intramural hematoma. We were true lumen, we probably could have taken an antegrade puff there, but because we have the dual lumen Sasuke catheters here, we use that to wire the lower branch there to preserve the bifurcation. We did it all by IVUS marking of where the origin came off with no dye. Did some ballooning of the branches, put some stents in, of course, recrossed with the dual lumen catheter to rescue that branch, did some kissing. You can see our final result here with nice preservation of the bifurcation system. So just a nice typical use of the microcatheter system. How about a little bit more challenging than the dissection reentry case here? One of our typical one radial, one femoral approach for this case here. You can see it's a pretty blunt occlusion proximal with some bridging collaterals. Nice, good distal landing zones. This would be a great ADR case if we don't get true lumen. It's a pretty long occlusion. Attempting this in an antegrade fashion here. You can see in the second picture there, the wire is going pretty straight. You can see some of the calcium going to the left, and we verified that we're probably not following the true lumen, so we pulled back, just did a simple knuckle wire. That's a Mongo wire knuckling around with the Corsair Pro XS. Microcatheter was able to swap out. We switched out for the Stingray system. You can see in the first picture here, the two wings are completely opposite where we want to be. The middle picture shows that we're nice in side view of the Stingray. You can clearly see we're below the lumen. Did a reentry here with our wire. This is actually Hornet 14, popped in quite easily to the distal vessel. Swapped out easily for the Corsair Pro XS. You can see it advancing quite easily to the distal vessel here. Torque transmits very nicely, even through all the tortuous proximal segments. Did IVUS again, verified the true lumen. Few drug-eluting stents here, post-dilate at high pressure. You can see our final picture here. And finally, a little trickier cases now. Again, this is certainly the wheelhouse of where the Corsair Pro XS tends to shine, so the retrograde cases as well. That may be trickier for some of the larger microcatheter systems in the past. You can see here another RCA. This was actually attempted before with antegrade wiring only, so you can actually appreciate a little bit of residual dissection there. This is approximately 4 weeks after the previous attempt. Probably should have waited a little bit longer to let this heal up. You can see some initial dye hang up down there, probably some residual dissection there. Probe this gently in the antegrade fashion. This is actually a Corsair Pro in the antegrade fashion, not the XS. You can appreciate more of the calcium now. This is why they had the failure initially from the antegrade wiring, just the big chunk of calcium you can see in the distal portion there. Not able to cross that. Again, you can appreciate a big, firm piece of calcium. Could not get anything to penetrate through there. Now you look on the left-hand side, there's a small landing before the bifurcation. You could certainly do a high-end ADR stick and swap kind of thing here, or stick and drive, and probably have salvaged both branches. We did get a Mongo wire down. It kind of knuckled past the bifurcation. I didn't want to lose both branches there. It's a pretty straightforward retrograde, so we converted to retrograde. This is just showing some of the difficulty with the calcified lesion there. More probing. And so some of the contralateral shots, a little bit of some tortuosity in this segment here. We did a tip injection of the first septal. Not a huge visual collateral, but you do see some ghosting in there. So there'll be a little bit of some blind surfing there. This is a standard Xi'an wire here. Again, the Corsair Pro XS. Get good wire movement through these microcatheters. Even though it's a very small, fine tip microcatheter, you still get very good tip control and wire control movement. You see across quite easily. I apologize for not fluoral saving the channel crossing with the microcatheter, but it flew through very easily to the distal cap there. You can see again the issues with the retrograde calcification as well. Couldn't puncture through, so we went around the calcium, got subintimal, and we're just planning for our reverse cart. Did some ballooning to get the trap liner down there. And unfortunately, this is the day we only had a 6 French trap liner. And in the 7 French system here, for some reason, we were not able to get the wire back in the guide liner, but we were in true lumen for sure. So we easily got out, we verified true lumen. So we just snared the wire in the aorta, got antegrade, exchanged out our equipment for our RG3 wire. You can see this picture here to show that entered just after the bifurcation. A little concerned that we might compromise that bifurcation. So again, we pulled out the Sasuke dual lumen microcatheter, put a second wire, a little Xi'an blue up to the PL branch to protect that here, and ended up working in an antegrade fashion. You see the almost a kissing microcatheters as we backed out the retrograde equipment and worked in an antegrade fashion now. Had 2 catheters, I apologize, 2 wires there. You can see the top left panel, that's our dual lumen catheter. He's got kind of a somewhat retroflexed PL branch up there. Did some ballooning, both branches there. Did some IVUS to ensure that we were true lumen. before the bifurcation, actually, which was good. So we landed our stent just before the bifurcation, put 3 drug-eluting stents in here, post-dilated at high pressure. And here's our final result. We actually did post-dilate that kind of mid to distal segment. These are Osyro DES stents. We post-dilate high pressure, and you did see a little bit of some recoil, the kind of calcified segment down there. We did hit that at high pressure, but we were satisfied with the result. We did some gentle ballooning in that PDA branch there, and hopefully that will get some positive remodeling in the near future. So in summary, the Corsair Pro XS summary has several key technology improvements over the previous Corsair Pro microcatheter. It's designed to be the lower profile. It's actually the lowest profile torqueable microcatheter on the market right now. So it's very useful for not only your CTO procedures, but we find that we use our microcatheters for many of our other complex procedures, using a lot of the toolbox we have for CTOs and translating into a lot of the other very highly stenotic, calcified, tortuous lesions, things like that. So it's not just for your retrograde CTO procedures. It has a very flexible tip. It maintains your pushability, penetrating forwards, has good torque transmission with those graduated wire tapers that Asahi is able to manufacture to their specifications. And again, with that graduated braiding, the new Shinka shaft. So again, just in summary, it's an excellent microcatheter, again, for your retrograde and collateral tracking, but also great for tortuous antegrade procedures and your complex PCI procedures. So thank you very much. I'd encourage all of you to reach out to your local Asahi representatives, get your hands on some of these catheters. They have some great benchtop models. You can play with these and get the feel of how remarkable these new technologies and catheters are. Thank you very much.